Today, we're going to talk about parenting, which during the pandemic is taking burnout to a whole new level. It's uncharted territory. Long gone are the days where you send your child off to sports practice or school or camp. Now, parents are juggling, working, and teaching with everything in between. That's why we're here today with Dr. Zachary Blumkin, Columbia Psychiatry go-to expert on parenting advice. He did his undergrad at University of Colorado Boulder and completed his doctorate at William James College in Health Psychology and Latino Mental Health. And his expertise is in navigating all levels of the education system, addressing family issues, and teaching parenting skills. It is so great to have you on today, Dr. Blumkin.
Super excited to be here. Thank you so much.
I have 3 kids. I know you have 3 kids too, and my youngest is 18. So I finally feel like I made it enough that I can actually say some things about this. I was always a big proponent of kind of positive parenting and a lot of focusing on the behaviors that you want to reinforce. And so a lot of, doing rewarding type of behaviors for what you wanted to see. So I'm curious, can you reward a child too much?
I love that question. I'm so happy to hear that you were into positive parenting and using rewards. Rewards are a really, really effective tool on helping children of all ages learn new behaviors. And the way we want to think about rewards, it's not that you can use it too much. It's just how you're using it and when you're using it. And so, for example, I'm thinking of children who are struggling to do something. Maybe they're struggling because they don't have the skills, or maybe they're struggling because they just don't like to do it. It's a great time to begin to use rewards. Rewards help those children engage in behaviors that they don't necessarily want to do. They help build self-esteem, build self-efficacy, and really importantly, they improve the relationship between the parent and the child, because we're using rewards to kind of take care of the dirty business, the things that they don't necessarily want to do. And the way that I think about doing rewards is really kind of starting small with small different things or activities, maybe like making a bed, and really thinking about what reward do they really want to make that bed. And that can just be really helpful on getting them to do that activity that maybe is a little bit more undesirable.
I love that analogy because depending on what age the kid is, what the behavior you're trying to incentivize is going to be different. And, making the bed is a really good regular routine. And I think so many times as parents, we expect our kids to do certain things and we don't realize that, maybe having them understand why they do it or incentivizing them to do it is a way to change behavior. So I find that really interesting.
For me, I think what you said, the key piece is routine. And so when we're thinking about using positive parenting or rewards, you want to think about, okay, so the child's not making the bed at all. It's not part of their repertoire. It's not an expectation. If we start to reward it, it's extrinsic. And then what generally happens is it moves to more intrinsic. So that child starts noticing, oh, I like my room when it's neat, or maybe I can use the bed to lay out my clothes or put my homework down. Or they just, for some reason, a friend comes in and mentions it and it feels good. And so it can turn from extrinsic to intrinsic. And sometimes it doesn't even hit intrinsic and it just turns into a habit. And now it's a part of the routine, which means we can remove rewarding, because sometimes parents get concerned, well, I'm going to have to reward making the bed for the rest of their lives. You won't have to. Once the behavior turns into a habit, we can move to a new behavior that we want them to learn, a desirable behavior that will be helpful and adaptive for the rest of their life. So I think it's a great point.
And I really appreciate that too, because it could start with something as simple as making a bed. But when you get that extrinsic kind of reinforcement, that can fall into anything in life, whether you do well in school and then all of a sudden people start to see you as smart and they look to you for advice. And so you continue to do well in school, or, all of those types of things. If it starts out with reinforcement and then you end up owning it on your own, and that's obviously what we would want for all kids, right? Is to do the positive behaviors because they want to, or they get that value. So I appreciate that extra tidbit. Can we talk a little bit about COVID? I mean, COVID has really been this collective experience for the whole world. I mean, in some regards, everybody's experience is the same. And in other regards, people's experiences are very, very different. Kids of all ages, right, have experienced something very unique during COVID. How do you feel about that? Is this something that's going to have negative effects on them? Are there any positive effects of what everybody's been through?
Yeah, another really good question. I think the truth is that we don't know what the sort of long-term or midterm effects are going to be, and we're going to have to wait for the dust to settle. I think that a really sort of negative consequence that's coming from COVID is the fact that children aren't able to go to school. And I want to be really clear. I think it's important that we follow the CDC and World Health Organization guidelines. So I'm not saying that these the consequences that I'm going to discuss in any way trump the idea that somebody could get very, very sick from COVID, whether that's a teacher, a school administrator, somebody who's bringing that child to school. Those are very serious risks. There are risks when children don't go to school. And for some children, it's not access to certain services that they would get otherwise, whether that's educational support, health services. There's limited physical activity when they don't go to school. And of course, there's social isolation. We know that that's been giving children and families trouble since the beginning of this pandemic. And it's a really, really tough situation for parents. We also know from a pretty large research study that came out in December of 2020 that there are certain risk factors that put children and families just at a higher vulnerability to suffer from some of the stressors of COVID. And these risk factors include family members who have acute or chronic health issues, children who have special educational needs, sort of single parent homes, lower income homes. These are all folks that are really, really struggling right now. And I think it's imperative that the communities come in and support those folks, that local and state and national, federal governments support these individuals, and we as family members support individuals. And I think that there are things we can do to reduce those risk factors. And they're pretty clear. They're a little bit mundane. They're things that I'm sure you did with your three children, and they're really important. And that's really regulating sleep and bedtime. So important. And sometimes we can get a little bit loose because of the pandemic. We're not going anywhere in the morning. Maybe we don't have school the next day. Increasing physical activity. I know it's limited in certain parts of the country, maybe where you live, it's difficult to get out. Doing burpees in your apartment, doing pull-ups in the basement, whatever you can do to increase that child's physical activity can be super, super helpful. And then last but not least, you really want to think about limiting that screen time. And I know that's hard because they're getting a lot of their interactions with other people with screen time. Maybe they want to play video games, watch TV, or they're even doing school on screens. But when we can limit screen time, it can be really helpful. And the last thing that I'll say that I think is really important, and it is, certainly a positive consequence that's come out of my life, is depending on other family members for support. And a really nice example is one of my older brothers and I, we play a video game online at night. I won't tell you which one we play on our phone because I don't want to endorse any of them. But we play this video game, and my 10-year-old niece started observing. And over time, she asked her father if she could play. And now the three of us play the video game. And it's brought me and my niece so much closer. And she'll text me, she'll say, "Oh, can we play tonight? Like, what's going on?" It's been a really nice way to kind of buffer the fact that she really is socially isolated. She's not going to school. She doesn't get a lot of that interaction. And for me, it's been really beneficial to have that relationship and that social interaction as well.
I love that. That's such a sweet story. I mean, that's really turning that screen time or that game time into something positive. And in a way, if you think about the days like when I was growing up and we would play board games, it potentially could not be that different. I mean, you're still engaging with people, and it's just the platform is different. Now you're doing it online instead of around a table. But those are some really good concrete advice for people. Now, hopefully, we're on the end of this and things are going to get better. But as we know, there'll be an aftermath. And I just think about it, how much we learn from other people and how they respond to us, and to think about kids not having that for so long, and spending, especially for the teenagers, I think so much time in their head ruminating about things because they're not having those experiences. And I guess you're right. We won't know until this all shakes out. But I just hope something positive comes of it. I think we all do. We hope that there will be these silver linings, and maybe we just don't know what they are yet, but hopefully they will. Going back to parenting, I was never a big time out person with my kids. I just felt like it was giving them attention, like negative attention, and I didn't think, and it didn't really benefit for the type of parenting that we did. And I went to grad school before I had kids, so I really soaked up all of these parenting things. That's what I did. But I'm just curious for all parents out there, it's all so different. What are your thoughts about timeouts? Are they helpful, harmful?
I think it's fantastic that you didn't have to use timeout. I think there are many families out there that sort of experienced, the ability to parent without doing that for whatever reason, and that's fantastic. I think there are times when timeout is appropriate. It's not harmful, and it feels like every couple of years these research studies come out and indicate that it really is a harmful intervention, and it's not. It's endorsed by the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and most parenting experts will indicate it really is a tool that can be used like any other tool. Now, the key here is you need to use it correctly. And that can be really challenging to know how to actually deliver time out in a really effective way. And one resource that I endorse, it's really inexpensive. You can get it on Amazon. It comes in many different languages, is a book that's called SOS Help for Parents. And it has 2 or 3 chapters that really very clearly outline timeout, outline how do you introduce timeout to your children? Where do you do timeout? How long do you do timeout? What do you do when it's over? And what are the common problems and errors? And I think if you can use a resource like this to guide yourself, timeout can be a really, really effective tool at sort of communicating to a child that was a really, really harmful behavior, and we need to stop that behavior. And so it can be a really effective tool. But I want to be super clear, it's only one of the many tools that we want to use: rewarding, praise, validation, modeling. Those interventions are equally or maybe even more important than timeout. However, just kind of taking a little bit of the stigma away, it is an okay intervention to use. You just want to make sure you're using it correctly.
Thank you. And I appreciate the recommendation of the book because I think that also helps people understand more. So, on the note of these different types of parenting, can you talk a little bit about consequences? Good, bad?
I mean, I think consequences are good, and the truth is that we all experiencing consequences all of the time. We learn from that experience of what happens after a specific behavior. So when I think about consequences in parenting, I'm thinking about 2 different types. One is natural, and one is logical. Natural consequences are consequences that occur because the universe or the environment outside of the home has delivered them. So I'm thinking of maybe coaches, teachers, school administrators, friends. I'm thinking of the sidewalk when some kids skateboarding without pads on and they hit the curb and they fall and scrape their knees. That's a natural consequences. These consequences are really important to let them occur. All right. And sometimes as parents, we have this urge. I don't know if you have this urge. I have this urge with my children to sometimes soften that blow. But it's really important for our children to learn from those experiences what happens when we engage in certain behaviors. And unless, I will say this, unless it costs a lot of money, or if it's going to be unsafe in some way, then obviously we need to step in and we can't let a natural consequence occur. So property damage, or maybe going on a bike without a helmet. These are examples that I think where you don't want to let the natural consequence occur. But in other cases, I think it's really important. And I think the younger you allow these consequences to occur, actually the lighter the consequences will be. So for my 5-year-old compared to your 18-year-old, that consequence is going to be much lighter for a 5-year-old than an 18-year-old. The other consequence that we don't really like, and we have to do in parenting sometimes, are logical consequences. And this is what we think of like the punishment fits the crime. So when a child engages in a behavior that's undesirable, maybe could cause them harm, we need to respond with a consequence. We want to make sure it's short term. We want to make sure that we're delivering the consequence immediate. So what I'm thinking of is maybe a teenager that sneaks out, okay? I wouldn't send that teenager to reform school. I think that's probably a little bit too far, but maybe asking that teenager, or requiring that teenager, I should say, to keep their location services on for a month. That seems like kind of an appropriate consequence. I also want us to think when we're delivering consequences or logical consequences to make sure you understand the problem behavior really well. And here's, I'm sort of thinking back to Les Mis and going to Broadway, right? Why did they steal that loaf of bread, or what happened in that moment? And really understanding that can kind of help you understand what type of consequence is appropriate in that situation.
I think a lot about resiliency. We work at Psych Hub a lot about, just resiliency and what builds resiliency in people, and just having spent decades on this, I think it's fascinating and I think we're still learning so much of it. But I have to think when I'm listening to you that a lot of it comes from consequences, that over time you become more resilient. You maybe are able to take more calculated risks, have more confidence because you have more successes. And that's because nobody shielded you from things going wrong. And I think it's sometimes a natural kind of inclination of a parent to protect you. If I hear you correctly, I think what you're saying is really you are raising independent, resilient kids when you allow them to have consequences. And that doesn't mean you're a bad parent because they experience something that might be adverse. Obviously, that doesn't cost too much or property damage or harm them in a way. So I appreciate that kind of caveat. But with that said, it's like you have to almost reverse your thinking as a parent, that your job as a parent isn't to make your child's life perfect. And in so many, and there's different ways to do that. And I think it's hard, but if you can look at it potentially as it can help build resiliency, I think that's an interesting way to kind of frame it.
I love that. And I'm going to bring you in to co-lead my parenting groups with me because that is such an excellent point. I couldn't agree with that more. And I'm going to even take it a step further. When you interfere or try to soften the blow, there is sending a message to your child that you can't handle this. Right. And that can actually, in some ways, affect that ability to build that resiliency, that self-esteem, and that self-efficacy. So, such a wonderful point.
So I'm curious when it comes to parenting, are there some techniques we shouldn't use at all?
So I've worked with a lot of different families in a lot of different cultures. Actually, worked in different countries and seen many different experiences. So this isn't about being pejorative towards one culture or one belief. I think it's just talking about the science, which is really important. But corporal punishment or physical punishment really is not an effective parenting strategy. And I think it's something that parents really need to stay clear of. And again, it's about really working with those families and understanding where they came from and what parenting experiences they had as a child or what they were exposed to as a child with their parents. So corporal punishment, physical punishment, even spanking, there's no research to indicate that these practices are helpful for children. All right. There's research that indicates that actually after physical punishment, you're increasing the chances that that child could present with aggressive behaviors, hostility, rage, a feeling of powerlessness, that, they in turn could be more upset and have further mental health issues beyond what they already presented with, which was the reason why they might have received that physical punishment from their parent or an adult. I think that that's something that we really want to be mindful of because physical punishment really doesn't stop that undesirable behavior and comes with a lot of negative consequences. The other thing that I think of is that often after delivering a physical punishment, parents then feel guilty, which then inhibits their ability to use more effective parenting strategies. And there are a lot of effective parenting strategies. So I would say stick to the effective ones, the ones that we've talked about so far, and hopefully the ones we'll cover going forward, and move away from physical punishment in any form or fashion.
Do you have any advice for parents who, if one of the parent engages in kind of more physical punishment and the other one doesn't, and they don't agree on it?
Yeah, I mean, I think that that's really hard to do, but I would say that in that situation, I would go to a trusted person. And in some places that could be clergy, some places that could be a primary care physician, that could be a mental health mental health clinician. It could be a teacher, and really sitting down and having an open conversation that is not based on judgment and based on saying one parent is bad and one parent is good, but it's literally looking at what we think is most effective and what's not, and being willing to try something new. I don't think it's helpful when we start judging people and telling people that they're bad and they're this and they're that. I think it's more about educating, and that's the most important piece. And so if there's two partners that disagree, finding a trusted person who has the science and the knowledge and can promote that, I think that's the most important piece.
Thank you. I appreciate that. So, as far as parenting just tips, what would you say is the number two? We'll get to number one next, but the number two parenting skill you recommend?
I love this question. It's like the top five. It's a great game to play, right? From like that Chris Rock movie. Number two, I would say is probably differential attention. So differential attention is essentially taking two skills and using them at the same time. The first skill is what we call active ignoring. So if there's a behavior that your child is presenting with that's not harmful, it's not going to cause any property damage, no one's going to be harmed, and it can be tolerated if it's ignored, right? So an example of a behavior that may not be able to be tolerated, excuse me, is like a bamboo kid's plate, banging it on the table. It's probably not going to do any property damage, but it's too disruptive in those moments. Those are behaviors we can't ignore. But whining, crying, nagging, tantruming, these are behaviors we can ignore. And if we engage in active ignoring, like actively looking out for them and turning our gaze away, moving our body away from it and ignoring, it will stop. And I think Neil deGrasse Tyson said it. The good thing about science is it works whether you believe in it or not. So if you ignore it, it will stop. Now, something to be prepared for is it will increase, right? So that negative behavior will get longer and louder and more disruptive. But if you ignore it long enough, it will stop. We call that the extinction burst. And that's really an important moment and a really important parenting strategy is to ignore it until it stops. And now we pair that with positive reinforcement or praise. So once it stops, what we want to do is praise the positive opposite. So if we go back to the tantruming example, if a child was tantruming, and then all of a sudden they stop tantruming, you might go to them and say, I'm just really proud of you for controlling your emotions. It makes me so happy. And then walk away. You've now just communicated to that young child, or maybe even to that teen, that when they engage in an undesirable behavior, I'm not going to pay any attention to it. And when you engage the behavior I like, I'm going to communicate how it makes me feel and how it's a good thing. And I want you to practice it more. A really effective strategy that can be very hard to do sometimes.
Wow, I love that so much. 'Cause when you think about it, the tantruming example that you gave, it's like, why is the child doing it, right? So if you think about the why, maybe they're doing it because they want their parents' attention. So again, it's counterintuitive, but if you give the attention, then you're reinforcing that behavior. Oh, every time I want my parents' attention, I can tantrum. But it's probably more effective, sounds like from you, to just ignore it. And then if you ignore it and then you give them the attention when they don't do it, you just reinforce to them, oh yeah, this behavior doesn't work for me, but by not doing it, I can get some attention.
Absolutely. And on top of that, they may be doing it to get your attention. They may also be doing it because they don't know what they're supposed to do or how to do it. And by giving them no attention for it, it communicates that's not what you're supposed to be doing. And when you give them attention for engaging in that desirable behavior, it can help change it. So you're absolutely correct.
That's really, really good advice. And, you know, we do the best we can as parents, right? We don't get into the all of a sudden you've got this baby and you're like, oh no. And it's this such a responsibility. And I love how you talk about parenting from no judgment and that there's no right or wrong. And people really have to do what works right for them. And then be ongoing learners as parents, right? Just because we do it one way or we parent a toddler, we might really need to parent an adolescent differently. And I just love that we have so much at our fingertips now with, books and blogs and podcasts. But I think it's also important that we listen to people like you from reputable places like Columbia when we think about our advice, because I'm sure there's a lot of bad advice out there too. So without further ado, I know is what everyone's waiting for. What is your number one parenting recommendation?
So number one comes straight and from my training and my experience and my practice from dialectical behavior therapy, and that's validation. Validation is a word that we hear a lot of, but I don't know that people have a firm grasp on it. I think it's often confused with praise. Praise is communicating to somebody that you like what they're doing. Very important parenting practice, but it's different than validation. Validation is communicating to someone, maybe your child, maybe your partner, maybe your parent, maybe a colleague, your boss, that you hear them, that you understand them, that you get their emotions and why they're feeling that way, that you get their thoughts, why they're thinking that way, and even you understand their behaviors. A key to validation is you don't necessarily have to agree with them to understand them. We're just communicating that I hear you and I get it. And that can be such a powerful tool to helping someone regulate. And what I mean by that is if somebody is really dysregulated and upset, and another person comes to them and validates them and expresses that I hear them, they will become more calm, more emotionally regulated. And in that moment, we're increasing the chances that that person can make an effective decision moving forward. All right. And so a really good example is what we talk about in DBT a lot, which is we don't necessarily always validate the behavior, but we might validate a feeling. So a teenager that doesn't study for a test, all right, we knew they didn't study for the test. We're pretty sure as parents that they weren't going to do well because this isn't their greatest subject. They come home and they're upset because they did inevitably get that bad grade. So I wouldn't validate and say, oh, it makes sense to me that you didn't study, right? I wouldn't validate that. But what I might say is, I get it. You're really, really upset because you got a bad grade. That class has really been difficult for you. I understand that you're upset. Right then and there, hopefully, that teen will feel heard. And if that teen feels heard, they'll be able to make a better decision next time about prepping for that test or how they're studying or how much they're going to study for that test. It can be a very, very powerful tool. When we invalidate somebody, it can send them to a more dysregulated place. So coming back to that example, the teen comes home and we say, well, you should have studied more. Or we say, why didn't you study? Or maybe we try to fix it, right? Maybe we say, next time I'll help you study. We should do note cards. I can help you now. Let's do it. That can also send them to a more dysregulated state, which means they're less likely to make a more effective decision. So validation can be a really, really important key to help folks kind of just get through that moment, that difficult moment. It is a very, very hard skill. And it's a hard skill because most of us don't like to sit with someone when they're really, really upset. So I have another resource. It's a great book. It's called The Rabbit Listened. It's by Corey Duerfeld, and it gives a great example of behavioral validation of just sitting with someone, just being with them when they're really not feeling well and helping them get through that difficult moment. And it can be a really, really powerful tool on teaching parents on how to validate, and I highly, highly recommend it.
I love that. When I listen to you, I have to think that it's almost could be as effective for the parent as it is for the child because it would teach us parents not to fix things, right? Which we tend to go in just as people all the time. Someone's struggling, we just want to fix it. We just want to make it better. And in that regard, you're not, right? You're really just validating where you are at that moment in time. And goes back to that kind of resiliency thing is like not everything can be fixed. And a lot of times people don't even want advice on fixing things in that time. They just, to your point, need to sit with it. And what great life skills that is for all the things that go wrong in life down the road to be able to sit with things that don't go right and know that you'll come out on the other end.
Absolutely. And I'm definitely going to have you come to my parenting class. Like there's no doubt about that. I think the other piece we want to say about validation, which is tricky, is you can't validate the invalid. All right. And that can be a little bit tricky. And you'll have to maybe like think about that a little bit more clearly. But one nice example I give is somebody comes to me with fear of flying and they say, I'm really afraid that my plane is going to crash. I'm not actually going to validate that the plane is going to crash because statistically speaking, it's probably not going to crash. But I can validate the feeling that they don't like going into a metal tube that's then propelled into the atmosphere. That makes sense to me. Even if I don't feel that way, even if I don't agree with it, I get where they're coming from. And hopefully they can get more regulated in that moment so we can actually talk about tips and strategies to get through the fear of flying. So a really great example that you talked about relating it to resiliency.
Yeah, and just on that too is again pushing yourself past your comfort level. We've heard on some of these other episodes where how important that is by doing that. So when you're able to kind of take it outside of that context of your fear is real because it's real to you, but now let's work on putting it out there and trying to go against it. So I think this is so helpful for so many of us. I know I'm supposedly be done with all my questions, but I do have just one more. And this is really more for the parents. What advice could you give parents that feel exacerbated or are working to be the best parents they can, but they slip up and they don't behave in a way that they feel proud of? I mean, maybe they did more timeouts or they lost their temper and they then go into that negative cycle of I'm a bad parent and I can't do this. And do you have any advice for them to help them get through it?
Yep. So I think one is to recognize that even the experts slip up. And my wife says to me from time to time, "Aren't you supposed to be an expert in this? Are you really supposed to be doing that?" So I think one is to note that we're all human and we all make mistakes. Another piece is that validation, using some self validation of this is really hard. So parents who are maybe a little bit looser with bedtimes during the pandemic or looser with screen time, it's knowing that it's understandable. There's a lot going on. We have a lot to manage. So, not being so hard on yourself and recognizing when maybe we deserve a little bit of understanding and support towards ourselves. I think the last piece, which is really important and we forget as parents, self care. Going out, getting away from the kids, getting takeout from your favorite place, going for a walk, seeing a friend, having a Zoom call, whatever it may be, using the Peloton, doing whatever you need to do to kind of get through this. But taking care of yourself is so, so important. And I think when you can do those three things, you can hopefully pop out of that sort of negative thought pattern that you're a real, real awful parent, when really a lot of us struggle with these things. And the topics that we discussed today are really hard to do. All right, they're not easy, and I think it's slowing it down, taking it step by step, and just trying to be the best possible parent you can be.
Thank you, Zach. You are just really incredible. And I'm really grateful that you're out there helping all of us parents that are trying to do the best that we can. We all could use the help. And I really appreciate the thought that you put into your work and doing this in a way that's going to affect so many lives. I hope we get to have you back on the show soon.
Thanks for having me. I will come back at any time.
As always, thank you for listening to our podcast. If you enjoyed the show, drop us a review. If you haven't already, subscribe to our podcast for the latest episodes. For the latest insights, check us out at psychhub.com.